second.
But we'll start off with a quick introduction by Freelanti, and then she'll be introducing you and then handing it over to you. We're just giving it one more minute for more people to join.
Okay, okay.
Yeah. Okay. So अब वो अभी पहले ये इसको ओपन करो और जब ये हो जाए ना तो ओपन का ऑप्शन आएगा अभी बस आएगा 1 सेकंड में.
Assalamu alaikum, Freelanti. You can go ahead and get started, inshallah, and others can join.
Sure. Assalamu alaikum. This is Farida Zuberi. I would like to introduce our guest speaker today, Diana Verla. She works for Social Security Administration and she is public affairs specialist. I invited her. I heard her a year ago at our office talking about all the Social Security programs. So at that time, I thought, oh, ICCL community need to know this information. So I asked her to, represent her and, give her some information. So she agreed. So I'm very happy. And thank you very much for coming in and talking to us. And she will, when we talk about the Social Security, we think only Social Security is the retirement, but Social Security Administration offers so many programs. So she will talk about all those programs, retirement, all those key points she's going to discuss. So I think it will be very beneficial to us. So Diana, I will welcome you. Okay, one more thing, the housekeeping rules, please keep your phone mute, and if you're talking, then you can unmute it. And then you have any question, you could just type in the chat box, or if you would like to ask on the phone, then you could unmute and talk. So we will give her in between a break so we can answer questions, and then she start presentation again. So, okay, I welcome you, Diana.
Thank you. Okay. I will be, I think that you need to give me, good afternoon, everyone. And on behalf of the Social Security Administration, I would like to say thank you for inviting me to participate at this event. Thank you for your time. And I'm really hoping that the information that I will provide to you is something that you can use to make important decisions about your Social Security benefits. And if you excuse us just 1 second, because I guess I will, are you going to present the slides, or you are going to make me the...
Actually, you can share. Yeah, you have permissions to share your slides.
Okay, let me share then. I don't know if you can see my screen.
Not yet.
I think that you need to make me the
Co-host.
The host. You will have to make me the host, and then I will have to accept. And if not, if one of you can present the slides and
Yeah, I think he's working.
okay, it says that I am the host now. Okay. Now, are you able to see the slides?
Not yet.
Okay.
Sharing screen.
Yes, and that's what I am trying to do. Share my screen here.
Okay, it's
Now,
coming
can
up.
you see it now?
Yes. It's
Okay,
coming up.
perfect. Okay,
Okay, got it.
very good. Okay, glad to hear that we're able to see it now. Okay, so, well, as I said, thank you so much for inviting me. I'm going to provide to you a lot of information about all Social Security benefits. And what I would like to do is please hold your questions for a little while. I will be answering questions. I will be stopping from time to time to answer questions. And believe me, I prepare a PowerPoint presentation that will allow me to answer most questions that we hear in the office when we work in the community. So I think I know more or less the questions that you might have about Social Security. So I have a PowerPoint presentation that will answer those questions. And once again, I will still stop from time to time. So if you want, you can send your questions through the chat, or once it's time to answer questions, you can just answer your questions when I stop. One thing that I would like to let you know is that Social Security offices are open. It is a little bit different than what it was now a year and 2 months ago, before we started undergoing the current health crisis. But we are open. Our employees are teleworking, still able to help you. And we would like to invite you to visit us online, ssa.gov, because most businesses with the Social Security Administration can be done online. If you are not receiving your benefits yet, you can actually take a look at our publications. We have benefits planners, we have calculators, we have a lot of information to allow you to understand your benefits better. If you are actually receiving your benefits, there are also many things that you can do online. You can change your address, you can request information from your record. So please, if you have not done so, visit us online, create an online account so you can get access to your personal information. Of course, not everybody can go online, not everybody can do businesses online. The other way to contact Social Security Administration is give us a call. Our toll-free number is 1-800-772-1213. 1-800-772-1213. And also, you can actually go online and find the phone number and the address of your local office if you need to mail information to us or you need to contact us directly by phone. You can do that if you use our office locator. That way you can have the number of your local office and you can contact one of our representatives directly. So those are the two ways to contact Social Security. The offices are open and we have very few staff in the office, and most of the face-to-face interviews are really for critical cases. So once again, visit us online, give us a call. We can still help you conduct your business with us. And when I talk about doing business with the Social Security Administration online, the best way to do it is please create your online account. If you are not getting benefits yet, you can get access to your Social Security statement. If you remember, we used to mail the Social Security statement to let you know how many years you work, the benefits that you are eligible for, and also the amount of benefits that we can pay to you. Well, we only mail the statement to people who are 60 years and over. If you are not 60 yet, then you will not get your statement, but you can get it online if you have a My Social Security online account. What if you are already 60? Well, I still encourage you to create an online account, because then that way, since you're getting closer to the age to apply for benefits, once you apply for benefits, it will be very, very easy for you to do online. Now, if you're getting benefits, what happens? Still create an online account, because your online account will allow you to make changes of address, direct deposit. You can request information from your record. So the online account is good for people getting benefits or not even thinking about getting benefits in the near future. If you're on the call, please put your phone or your computer on mute so we don't get that background noise. Okay, now let's talk about Social Security. It's very important because like you and me, most of you probably, if you have not been born in the country, maybe some of you came when you were very little, might not remember what is the Social Security system in your country of origin. Like in my country, the Social Security system is quite different than what it is here in the United States. But in terms of overall, the way that Social Security works is that people work and pay taxes. Once you are working and you pay taxes, that is basically how Social Security is funded. The benefits that we pay today are funded by the contributions of employers and employees. Everybody who pays Social Security, FICA taxes, funds benefits for those that are receiving the benefits now. And in order for you to qualify to get benefits for Social Security, you have to work and get what we call Social Security credits. A credit is a measure of work. We are going to measure your work activity to find out if you qualify for benefits and what benefits you qualify for. In order to get one credit this year, you have to make at least $1,470. And a person can only get 4 credits per year. So basically, with $5,880 that a worker makes this year, the worker will make enough money to get the 4 credits this year. In order to qualify for retirement, you must have 40 work credits and you have to be at least 62 years old. The big question is, how many of us can just work for 10 years? Or how many of us have already made more than $5,880? So what happens to the rest of the contributions? What happens to the rest of the income that you put into the Social Security system? Well, what I can tell you is that there is a big difference between just being eligible for the benefit. And as I said, most workers with 10 years, because the requirement is 40 credits, you can earn in, most workers will earn in 10 years. So what happened after you have 40 credits? You work already for 10 years. You continue working. What happens to the rest of the contributions? 40 credits will only qualify you to get benefits once you reach 62 years old. But there is a different number of years that we use in the calculation of the benefits. We will actually use 35 years of earnings. These are the first 3 steps that we use in the calculation of your Social Security benefits. In the first step, we're going to take a look at all of the years you work. If you work for 40 years, we're going to take a look at 40 years. And then we will increase those years to current value because those earnings, you know, if you started working 25 years ago, maybe the value of those earnings is going to be different than the current value. So we will increase those earnings to current value, and then we are going to select 35 years. How do we get to select 35 years? The years that you made the higher amount of earnings. For most people, they are at the end of our careers. Because if you think about it, if you start working and you continue working steadily, your earnings just continue increasing year after year, right? But for some people, that's not the case. Because sometimes we have workers that start a career and then stay home to take care of a family and then come back to work, maybe part-time only. It doesn't matter. We also might have workers that did not work for 35 years. So what happens then? Well, once again, we will find 35 years of earnings. We will use the higher. It doesn't matter that they are at the beginning, at the end, some in the middle of your career. And if you don't have 35, what will happen is that we will use whatever number you have, and then we will put zeros in the rest of the years. I got a message stating that not everybody is able to see the screen. Are you able to see the slides? Can somebody send me a message, please?
Yes, I can.
You can. Okay,
Yes.
okay. I don't know. I know that I am sharing my screen,
Yes,
so
we
it might
can.
be it's some of the.
Are
Okay,
you
okay.
at the step 1, step 2, 3 slide?
Exactly.
Yeah,
So, okay. Well, I just got a message, a pop-up message kind of saying that some were not able to see the screens, but I'm glad that you verified that information. Very good. Okay, so let's go back to the calculation of Social Security benefits. As I said, these are the first 3 steps we use in the calculation. Then we are going to apply a formula, and after we apply a formula, that's basically how we will calculate your benefits. What I can tell you without fear of being wrong is that if all of us were to share the amount of benefits that each one of us will get on benefits, I can tell you that it's going to be different, because for each one of us, it will depend on the number of years we work, the earnings we had over those years, and then the age in which we decide to retire or to get the benefit is the other factor that will impact the benefits that we will get. And we will talk about the best age to apply for retirement in a bit. I would like to know if at this point we have any questions. Please, when I stop for questions, just ask me questions on material we covered so far. So far, we have talked about the calculation of Social Security benefits, how you become eligible for retirement, and we talk about how we contact with Social Security. Also, I recommended that you create an online account. Any questions on any of those topics? Do you see any questions, Fred?
No, so
No.
far no question. Yeah.
No questions so far.
Mhm.
Okay, so let's continue then. And once again, in terms of the benefits, remember that the benefits are based on the number of years you work, earnings you had, and the age when you take the benefit is the other factor. And I can tell you that is probably the number one question that most of us have? When is the best time for me to apply for retirement benefits? I can tell you that I don't have an answer for you. It's going to be personal, and only you will know the answer after you take a look at many factors. One factor that you need to know is that depending on when you take your benefits, you will get either a reduced benefit, a full benefit, or even an increase. There are different options, and you need to think about the different options to find out what is the best for you. First of all, you can wait until you are your full retirement age. Take a look at this chart. In the first column, you see years of birth. In the second column, you will see what is considered to be your full retirement age, depending on the year you were born. And then at that age is when we are going to pay you 100% of the benefits if you wait to file for benefits until that age. But what if you want to file for benefits earlier? Remember that I said that the earliest you can file for retirement benefits is 62. At 62, you can take the benefit at 62. But the third column is going to tell you the reduction you're taking. Because if you take your benefit at 62, you're getting a reduced benefit. And the reduction is permanent reduction. Let me give you an example. Let's say that we have a worker who has been born between 43 and 54. As you can see, full retirement age for this worker is 66 years old. Let's say that this worker wants to get benefits at 66. We pay 100%. But let's say that this worker really wants to get the benefits at 62. Then you see that the reduction is going to be a 25% reduction. And the reduction is permanent, meaning the worker will only get 75% of the benefits for the rest of his or her life. That is why it's important to get the information so that you make the right decisions about your benefits from the very start. Once again, if you take your benefits at your full retirement age, we pay you 100%. If you take the benefit early, you're taking a permanent reduction. There is also another option, which is you can wait until you are 70 years old. And actually what happens if you wait for your benefits until you are 70 years old, actually you are taking an increase. We will increase your benefits by 8% for every year that you wait from your full retirement age until 70 years old. The reduction and also the increase is prorated. For example, if your full retirement age is 66, but you take your benefit at 62, you will take a 25% reduction. The reduction is about 6% per year if you apply for benefits before your full retirement age. So let's say that the worker, instead of waiting, applying at 62, waits maybe until 64, 2 years before. Then the reduction will only be about 12%. On the other hand, also the increase is prorated. If we have a worker whose full retirement age is 66, but the worker waits until 70, we're gonna pay at the age of 70, 132%. Let's say that the worker only waits until 68, 2 years after, then we will only pay 160%. Finding out when is the best time for you to retire, it's going to be different for all of us. You need to take a look at the income that you will have if you retire. Are you ready to retire? Will you have enough other incomes? Also, you need to take a look at health. Health is a very important issue because we do have workers that apply for benefits earlier because they already might have a medical condition. We also have workers that at this particular time, we've seen a lot workers have lost their employment or hours at work, and that they are applying for their early benefits because that will mean that they have income for their families. It's gonna be different for all of us, okay? I invite you to visit us online, ssa.gov. We have a great publication that is called When to Start Receiving Retirement Benefits. Doesn't give you the answer, okay? But it will allow you to see the different factors that you need to take into consideration. Any questions so far? No questions?
I have a comment on that age. Most people, they don't realize, at the age 62, they think, oh, I can apply for Social Security benefit, but they don't realize they are losing 25% for whole life, So that's very important to keep in mind.
Yes, yes. And once again, for some workers that might work, We hear it all the time. We have workers that I had somebody who told me that he was working since he was 14 years old. At the present time, he is traveling like 1 hour, 15 minutes, 1 hour, half an hour one way to go to work. And he says, I am done. Enough is enough. I'm applying for benefits early. Remember that if you're applying for benefits early, that means that you're getting less, but you're going to get benefits for a longer period of time. Also, I have workers that said, hey, there are a lot of medical conditions that run in my family. In my family, people die very young. So I have a lot of chances of also dying younger. And therefore, I don't want to wait. So it's going to be a lot of factors that you need to take into account. But just know also that the reduction is prorated. The closer you get to your full retirement age before you apply for your benefits, the less reduction that you will be taking. Okay, thank you very much. Any other questions? Any other comments on that? Okay, we're gonna continue. We'll have some more questions at the end. Now, let's talk a little bit of benefits. And actually, as a matter of fact, this slide, I don't know if you're able to see at the top. On my screen, I cannot see at the top because I have the controls, but Social Security has a couple of disability programs. We are not only a retirement benefits program, we also have disability benefits, and we have two different programs that will allow us to pay benefits to people that are disabled. Towards your left, we have the Social Security Disability Insurance. That is for people who actually become disabled and they actually work, pay into the Social Security system. So they are eligible to SSDI, Social Security Disability Insurance, and the amount of benefits that we will pay to them will depend upon their contributions. But we also pay benefits to family members, and we also give eligibility to Medicare. Medicare is the National Health Insurance Program. Besides Social Security Disability Insurance, we also have Supplemental Security Income. That's the column towards your right. And Supplemental Security Income is really payment of benefits that comes from general revenues, Treasury, U.S. Treasury, and the benefits that we pay to people on SSI is a set amount. The program is really a program based on need, income, resources, It is very strict in regards to immigration status, living arrangements, meaning who the person applying lives with. And there is medical benefits through Medicaid, which is a state-based medical program. Under SSI, we can pay benefits to people who are 65 years or older, or people that are of any age, but they are disabled. It is not linked to earnings. People who have never worked can be eligible to disability or old age benefits if they are 65 or over on the SSI. This is the program that will allow us to pay benefits to children with disabilities because it has nothing to do with somebody working and receiving benefits. But as I said, it's very, very strict in regards to income resources, immigration status, and living arrangements. These two programs pay disability benefits. And in terms of disability benefits for the Social Security Administration, the concept of disability is that a person has a medical condition. It can be any type of medical condition. It can be a physical impairment. It can be a mental or emotional condition. In adults, that condition doesn't allow the person to work. And for children, it doesn't allow, the medical condition doesn't allow the child to develop at a normal rate. So that is basically the concept of disability for Social Security Administration. And in order for us to determine if a person is disabled or not under Social Security laws, there is like a 5-step process that that the person will have to undergo in order to determine whether they are disabled or not under Social Security laws. The first question would be, are you working? If the person is working, is it still okay? We will still allow them to work, but a person applying for disability benefits cannot make more than $1,310 this year. That amount changes every year. In other words, if we have a person that has a medical condition, but is still working and making more than $1,310, we're going to say that the person is not disabled. And believe me, sometimes it happens because a lot of times we have workers that say, I have to continue working because I have a family to support. But once again, for as long as they make more than $1,310 a month, we're going to say, you are not disabled under Social Security laws. If we have a person that is not working, or even if they are working but making less than $1,310, then we will go to the next step, which is, do you have a medical condition that is severe? And by severe means that it is a permanent condition. It is a condition that is going to last more than 12 months. And once again, it stops you from working, or because of that medical condition, you have to change your hours, you have to work less. And of course, if the answer is yes to that question, there is another question in regards to, is your impairment meeting the listings? A listing is basically the list of different medical conditions and the signs and symptoms of these conditions. Does the applicant have any of those symptoms and signs listed in those listings that we have? And actually, we do have available all those listings in our website. If you actually go in Social Security's website, ssa.gov, in the search engine, you can just type Blue Book. The Blue Book has all different medical conditions, and it also shows the listings. And that is important information because if you have a medical condition, but you don't know if that might qualify for disability benefits with us, I encourage you to go to the listings. And just know, as a matter of fact, that basically any type of medical condition, for as long as you meet 3 basic criteria, which is the medical condition, there is a medical condition, stops you from working, the condition will last more than 12 months. That is the basic concept of disability. In regards to the concept of disability, we are also going to evaluate if the person cannot do the work that they were doing at the time of becoming disabled, or a job that they were doing in the past, or a job that they can get retrained. It's a permanent condition that doesn't allow the person to work. Okay, and actually there is a state agency that will make this determination for the Social Security Administration. Of course, if a person is denied, they have the right to appeal on the decision. And there are 3 different levels of appeal. Once a person is denied, the benefits are denied, they can all appeal. If there is another denial on the reconsideration, they can request a hearing with a judge. If the judge agrees that the other decisions were correct, and there is another appeal, another denial, then the person can appeal once again. Any questions on the disability benefits? Any questions?
Hey, Diana, I have a question in the chat
Yes.
that's not related to the disability benefits, but somebody was asking, how do we get a copy of our Social Security card?
Sure. In regards to apply for a Social Security card replacement, if you are a U.S. citizen, okay, by birth or by naturalization process, I recommend that you create an online account because you can get a replacement Social Security card online. If you are unable to get an online replacement of your card, you cannot request a replacement of your card online, then the process is going to be, you can complete a form. It is SS5, S as in Sam, S as in Sam, and the number 5. It is available online in our website. You can print the form. Once you complete the form, you can send it to your local office. The form will also tell you the documents that you need to send. And you need to send original documents to the local office in order for you to get a replacement card. I mentioned at the beginning that you can get the address and phone number of your local office, the office that serves the area where you live, if you go online, or you can just give us a call at the toll-free number. Okay. Any other questions or any other comments?
Yeah. Can I ask a question?
Absolutely, please.
Okay. My question is, what happens if you retire at the age of 64 and still work?
Okay. What happens if you retire at 64 and still work? Okay, let's talk a little bit about it, because yes, you can work and receive Social Security benefits at the same time. Now, in this case, you are 64.
Okay.
So the amount of the earnings that you can have this year is $18,960. If you make over that amount, then we are going to take $1 of benefits for every $2 that you go over.
Okay.
So let's say that you make $20,960. Okay, we take $1 of benefits for $2 you go over. So basically $2,000 is your excess earnings, right?
Yeah.
We don't pay you $1,000. If this is the first year of application, we will go on a monthly earnings test because it doesn't matter how much money you made before you started collecting your benefits. But the month that you are eligible, entitled to the first benefit, and then you still work, we just go on a monthly earnings test, okay? But the second year, we go on a yearly amount. You can make that amount in 1 month, throughout the year, during the summer only. What happens after is that once you reach your full retirement age, as you can see from the bottom row, at full retirement age, the month you reach your full retirement age, you have no limit in the amount of earnings that you can have.
Okay.
Okay. The information you see in the middle, the year full retirement age is reached. That is for a worker that wants to start collecting benefits from the beginning of the year, but the worker is not yet full retirement age, but that's the year that the worker is going to be full retirement age.
Okay.
Well, between the beginning of the year and the month before the worker is full retirement age, the worker still has a limit. But as you can see, that's the information in the middle. The limit is much, much higher. And beginning, once again, the month the worker reaches full retirement age, no limit. Did that answer your question?
Yeah, there's a follow-up question too. If
Okay, what is your follow-up question? Tell me.
When you retire at the age of 65, you I'm told you get the Medicaid, right?
Oh, we'll talk about Medicare in just a few.
Okay.
So hold on to your question, please. Any other questions on any we covered so far? Retirement, disability, working and receiving benefits. Oh, one thing that I would like to mention in regards to these limits that you see here, they are only earnings, strictly earnings. You work and you get a salary, or you even work in self-employment. It has nothing to do with any other incomes that you have, okay? Any other questions?
Yeah, I see one question on the chat box.
Okay.
It says, how does the disability criteria apply to children?
SSI applies
Yes.
to children?
And disability criteria.
Yes. Once again, SSI, the supplemental security income, is the payment. We can pay benefits even to children with disabilities because it has nothing to do with you work and get credits. The only thing sometimes with children is that under the age of 18, we are going to take a look at the income and resources of the family. And a lot of times what happens is that with children under the age of 18, since we take a look at income and resources of the parents, if we have two parents or sometimes even one parent, depending on the family composition, depending on how many other children in the family, if we have one or two parents having, average earnings, they might not qualify for SSI. Because of remember, I said that SSI is very strict in regards to income and resources. What happens is that once the child turns 18, then even if the child is receiving support, food and shelter from the parents, and the child is still living at home, we're gonna take a look only on the income and resources that belongs to that child once they reach age 18. Okay. Did that answer your question? And let us know in the chat, please. You send us a question through the chat. Okay. Now, let's talk about one factor. Remember that I was talking about in terms of retirement, factors that you have to take into account to find out when is the best time for you to retire. Working and receiving benefits is one of those factors because certainly if you know the amount of earnings that you can have, if you know the amount of benefits that you can have, that can help you make your decision on when is the best time for you. Another factor that you need to take into consideration would be taxes, because if you receive certain amount of income, you might have to pay income taxes on Social Security benefits. If your income is higher than $25,000 for single taxpayers and $32,000 for couples, then you're going to have to pay taxes on some of your benefits. Know that you can request that Social Security takes taxes from your benefits, so that way you pay those taxes, throughout the year instead of waiting until you file your income tax return. So once again, I'm not an expert on taxes, okay, but I would like for you to be prepared. First of all, know what is the income, what will be the amount of your income, and know that if your income will be higher than 25 for single taxpayers or 34,000 for couples, then be prepared. You can have to pay taxes on some of your benefits. And also, it's easier to request that we take
The screen jammed.
What happened? I don't hear anything.
Yeah, I think his screen is jammed. She lost the connection, I think.
Yeah,
Oh,
we can inshallah, we can give her a minute, inshallah, to get back on. She may
okay.
have just had a technical difficulty. Yes, it looks like she just logged off, so she should be getting right back on. She's probably restarting her Zoom.
Oh, we don't have to relog it though.
No, it's only Diana.
Okay.
I'm calling her. Hmm. Yeah. She lost power for a second. She's trying to get it back.
There were a few people in the chat that were asking if this meeting has been recorded, and I'm sure they're asking because of all the slides and information that's being presented is very useful. So yes, the answer is this meeting is being recorded. It's streamed live on our YouTube page, youtube.com/ICCL live. So if you want to ever access this information, this entire meeting, you can go to the YouTube page and it will be posted on there. And you can also share it with other friends and family members who you think can gain benefit, inshallah.
Then
Oh,
if you
that's
need a
actually,
copy of presentation slides, we also have it, so we can send it to you.
oh, that's great.
So are you going to send the slides to everyone on this call, or we have to provide our email address?
I need the email address or phone number, so I can either text you or email you.
So if you can put your email address on the chat, if you would like to receive a copy of the slides, then inshallah Farida Auntie will send them out to you.
Great.
Hello, can you hear me now?
Yes, we hear you.
Yes.
Oh,
Yes,
thank
we
you so
can.
much. I'm so sorry. I lost power for a minute and that did the job.
No problem. We were all patiently and
Yeah,
anxiously waiting for you.
thank you so much. Can you do me a favor? Can you give me access, please, again? It says that you have disabled my screen sharing.
Yes, that automatically happened when you dropped off, but we just made you the host again.
I am the host again, and it looks like. Can you see my screen?
Yes, we can.
Awesome. Thank you so much. And I apologize, everybody. I was not
It's
counting
okay.
this.
It's okay. No problem at all.
Okay, let's start here. Okay, so let's go back on track. And I apologize, but in regards to taxes, I cannot answer any questions. As you can imagine, we're gonna leave that to the IRS. I strongly recommend that if you have any questions, you can most definitely contact them. Okay, they do have a couple of publications. As you can see, publications that are at the bottom of the screen, and they also, you can call them. They also have a tax withholding calculator that will be very useful if you're trying to figure out how much you have to pay or not. Okay, so let's go back to I was, before we got disconnected, I was telling you that probably one of the most important factors that you need to take into consideration when making a decision is about family benefits. And I have a comparison chart because most of the time people think about benefits for families when the worker is deceased. And yes, we have benefits for survivors or workers that are deceased, but we also have benefits for the family members of workers that are alive if they are receiving either retirement or social security disability benefits. So let's talk a little bit first when the worker is alive. That is the column towards the left. And as you can see, we can pay benefits to spouses. If the worker is retired or disabled, spouses that are of any age, they can be younger spouses, but if they are taking care of a child of the worker, of course, and the child is 16 years old or younger, or an adult child of any age, but a child that is disabled. We can pay benefits to a spouse of any age. We can also pay benefits to spouses at the age of 62 or even the age when they reach their full retirement age. The amount of benefits that we can pay to a spouse is 50% of the worker's full retirement age amount. And as you can see, We can also pay benefits to divorced spouses. And for divorced spouses, there are a couple of other requirements. And that is that they were married to the worker for 10 years. They've been divorced by 2 years, and they are single at the time of application. One thing that I would like for you to know and make it clear that if we pay benefits to a spouse, that doesn't take anything from the worker. Okay, if we pay benefits to the divorced spouse, that doesn't take anything either from the current spouse if the worker is remarried. And let me give you a few examples in regards to spouses so you will know how this works. Because if you are married or if you were married, if you work and your spouse or your ex-spouse work, potentially you're eligible for benefits on your own record because you work, or your spouses or divorced spouses record because they work too. So you're eligible to one of two benefits. How do we pay you? How do we know which one to pay you? The one that is higher for you. Let me give you a couple of examples. Let's say that we have a couple and there is only one worker because one of the spouses was a stay-home spouse. If the worker is going to get $2,000 at full retirement age, we are going to pay to that spouse. That stays spouse, we're going to pay $1,000. If we have a worker that, let's say, in another couple, let's say that both of them work, both of them pay into the system. Let's say that wife can get $1,800 on her own record and the husband can get $2,000 on his own record. For that couple, the best scenario is they get benefits on their own record because that is higher. We will always compare how much can you get on your own, how much on your spouses will pay you the higher. Maybe in another scenario, we have a couple and one of them actually had higher earnings, the other one had less earnings. Let's say that the one with the higher earnings can get $2,000 and the one with the lesser earnings can only get $500. Well, for the one that is only getting $500, there could be an adjustment from the record of the worker with the higher earnings. We will always make that comparison for you, for your spouse. Okay, just know that. All you have to do is complete the information that we have in the application about marriage. And that's the reason why we answer that question. Okay. Now, let's take a look at the column towards your right is for survivors. Once again, we're going to pay benefits to surviving spouses of any age if they have children under the age of 16 or even children that are adults but are disabled and became disabled before the age of 22. But also we can pay benefits to widows and widowers at the age of 60 or even 50 if they are also disabled. And we still pay benefits to a divorced spouse. And take a look at the rate of benefits that we pay. We can pay a higher amount if the worker is deceased. It can be anything from 71.50% to even 100%. And besides the spouses, we also pay benefits to children. All of the children under the age of 18 can get monthly benefits, and also children between 18 and 19, but if they are still in high school and full-time attendance, we can pay benefits to them too. And we also pay benefits to children even if they are adults, but they are disabled and became disabled before the age of 22. And it's the same requirements when the worker is alive or the worker is deceased. The only difference is that when the worker is alive, we're gonna pay an amount equal to 50% of the worker's full retirement age amount. In other words, if we have a worker that is getting $2,000 full retirement age benefits, we're gonna pay $1,000 to the child that is an adult but disabled. If the worker is deceased, the payment is higher. It is 75% of the benefits. Other survivors' benefits can include parents. If a worker was contributing to the support of parents to 50% of their support, then we will pay benefits to the parents if anything happens to the worker. And we still have a lump sum death payment, which is a one-time payment, $255, which can be paid to the widow or widower or to any children that can qualify for monthly benefits. Let me stop here one more time and see if you have any questions about family benefits, any questions about survivors, so we can talk about Medicare.
Only thing I would say is your camera is off.
My camera is off. Oh no.
Yes.
Okay. I don't know, then you didn't see the slides.
Yeah, we were able to see the slides.
You were
fine.
able to see.
Yes.
Oh, that is
And now we
good.
see you as well.
Ah, that is good. Well, for as long as you saw the slides, it's okay. It's okay. That's more important. But once again, any questions about survivors, disability, retirement? Those are the topics we covered so far. Any questions, anybody, please?
So Diana, along with having this session on Zoom, it's also being streamed live on our YouTube page, and we have a lot of viewers on there. And
Awesome.
one of the viewers on there asked a question, and I think you may have covered it, but the question is,
Let's talk.
sure, it's what are the options for a stay-home mother? Are they eligible for Social Security benefits?
Absolutely. Thank you so much for the question. And once again, yes. Remember that I just spoke about stay-home spouses, maybe stay-home spouses that did not work at all outside the household, or stay-home spouses that maybe work a little, but does not have the 40 work credits. They qualify for benefits on the worker's record for as long as they are at least 62 years old, or they can apply for benefits at full retirement age for as long also as the worker is already getting benefits. But we also pay benefits to younger spouses, any age, if they have a child under the age of 16, or even a child that is an adult but disabled and became disabled before the age of 22. So those are the benefits for spouses. So that is why it is so important that we learn about the protection that Social Security provides, because Social Security is really more than a retirement program. And we not only protect the worker, but also the worker's family. Okay, it's very important. Thank you so much for those questions. And thank you so much for all of you taking the time to be at the program and watching either, by Zoom or YouTube. Thank you. Any other questions? Okay, let's continue. We will have more time for questions at the end. Let's talk about Medicare. Medicare is very, very important because Medicare is the national health insurance program. And Medicare can be given to people who are 65 years old. That's the first time that people become eligible for Medicare. But we also provide Medicare to workers that are disabled at any age, and workers that are disabled can get Medicare 24 months after they start collecting Social Security benefits. There is only a group of workers receiving disability benefits who will not have a 24 months waiting period. And they are the ones who are diagnosed and receiving disability benefits because of Lou Gehrig disease. They do not have a 5 months waiting period, a 24 months waiting period. And also for disability, if you are found disabled, we cannot pay you benefits for 5 months. People with Lou Gehrig disease, they don't have to wait. We start paying benefits immediately. We give them Medicare immediately. But workers with any other medical condition have a 5 months waiting period for us to pay benefits and 24 months for Medicare. We also give Medicare to workers of any age if they are undergoing dialysis because of kidney failure. 3 months after they start dialysis, we can give them Medicare regardless their age. And Medicare is very comprehensive. Medicare provides coverage for hospitalization, for prescription, doctor's visits, medical equipment if somebody needs like a hospital bed, or durable equipment if somebody needs a wheelchair, for example. And like when you are working, that you have different options in regards to health insurance, Medicare is the same. Once you are eligible for Medicare, you have a couple of options to get the coverage. You can enroll in what we call the Medicare Original Plan, or you can enroll in a Medicare Advantage Plan. What's the difference? The Medicare Original Plan is divided in different parts, and each of the parts covers different services. Part A is hospital insurance. Anything that has to do with hospitalization charges is going to be covered under the Part A. Part B is medical insurance, doctor's visits, outpatient services, even services that are rendered in a hospital, but you are not hospitalized, is going to be covered under the Part B of Medicare. And we also have the Part D of Medicare under the original plan. Part D is the prescription program. And under the original plan, you can take all of the parts of Medicare at the same time, or you can take some now once you are eligible and some later when you need the other parts. That is the Part A original plan, A, B, and D. And because Medicare has deductibles and copays, you can apply for a supplemental insurance coverage, which is going to become what we call a Medigap policy. That Medigap policy will pay for expenses that Medicare does not pay. Now, under the Medicare Advantage Plan, the Advantage plans are actually private companies contracted by Medicare, and they provide more comprehensive care. Most of them are HMOs. So in terms of making decisions about Medicare, you need to make a decision whether your original plan will cover all of the healthcare needs that you have, or you will be better off on a Medicare Advantage plan. Some of the Medicare Advantage plans actually provide also coverage for dental and some vision, which the original plan does not cover. And once again, the Medicare Advantage plans are private companies contracted by Medicare. Now, in regards to filing for Medicare, when is it that you need to enroll in Medicare? There are 3 enrollment periods. We have the initial enrollment period, a special enrollment period, and the general enrollment period. The same as with retirement and cash benefits, I don't have an answer. When is the best time for you to file for retirement? It's the same with Medicare. It's going to be different for all of us in terms of when is the best coverage. When is the best enrollment period? What is the coverage that we need? Please, when you're making your Medicare decisions, get informed, because the decisions that you make today about Medicare will impact the coverage that you can get tomorrow. So please, please take the time. Once again, Medicare has 3 different enrollment periods. The initial enrollment period is around your 65th birthday. 3 months before you turn 65, the month you turn 65, and 3 months after. That's your initial enrollment period. During any of those 7 months around your 65th birthday, if you can file for Medicare, the coverage will begin depending on when you file. For example, if you file in any of the 3 months before you turn 65, your Medicare will start the first day of the month you turn 65. If you file the month you turn 65, then your coverage starts the following month, and it's going to be different. And once again, you need to get the information so you will know exactly when to file. But sometimes we have people who are 65 years old and they still work. Do they need to apply for Medicare? Do they need to file for all of the parts of Medicare? It's gonna be different. One thing that I needed to mention to you in regards to Medicare under the original plan is that Part A does not have a premium. Part B has a monthly premium per person. If you and your spouse will get Medicare, each of you will have to pay the monthly premium. The monthly premium for Medicare Part B is $148.50 this year. And that's the standard premium. For people with higher income, you have to pay a higher Medicare premium. Now, in regards to people who are 65 and still working, it might be that if you have health insurance through your current and active employment, it might be that if you are in good health, you don't need Medicare. You can take a Part A because it's premium free, but you might defer the Part B and Part D because you have to pay for that. And if you don't need the coverage, why pay for something you don't really need now? You are under what we call a special enrollment period. A special enrollment period is for people who are 65 but still work and have health insurance based on current and active employment, or their spouse's current and active employment. Because for most employers, if they have more than 20 employees, if you have that type of coverage, that is going to be primary. If you are in good health, don't need a supplemental plan, you can defer Medicare. You can wait to file for Medicare for later once you really need it. Once again, that is the special enrollment period, when people are 65 but have health insurance plan based on current and active employment or based on their spouse's current and active employment. You can defer Medicare. We even give you 8 months after you retire or your spouse retires and you're still under that special enrollment period. What if you miss your initial enrollment period, your special enrollment period? Can you ever file for Medicare? There is one more period, the general enrollment period. And as you can see, the general enrollment period is only from January through March that you can file. The coverage begins in the month of July of the year that you file, and there will be a penalty for not filing under the initial enrollment period or the special enrollment period. The penalty is an increase in the premium. It's a 10% increase for every year that you're over 65 and you did not have health insurance based on current and active employment. So please, please, when you're making a medical decision, take your time. Take your time. Think about your health. Think about the coverage you need. Think about the premiums that you are willing or that you will be able to pay. And also think about how your health will be in the next 5, 10 years. What if you happen to live 90 years old? Do you know how your health will be at 90? Okay, so think about all those different factors. Think about, if there are any medical conditions that run in your family and that you are prone to get. So take it slow when you make your medical decision or any decisions about any of our benefits. Any questions so far?
In the chat
Yes.
box,
Mhm.
go ahead, Rashid.
Yes.
No,
Yes.
no, Farida, auntie, go ahead.
Okay. What if a person doesn't have enough credit qualify for Social Security benefits? Can that person get the Medicare at age 65?
Absolutely. There is a provision in the law. If we have a person that doesn't have 40 work credits, but is 65 or older, we can provide Medicare. The eligibility criteria, okay, the requirements will be that you are 65 years or older, that you have a permanent residency card, and that you have been living in the United States in legal status for 5 years, consecutive 5 years. Those are the minimum eligibility requirements if a person does not have 40 work credits. And moreover, the same requirements if the person has lower income and resources, the person can apply for the state where they live for additional benefits. And also just know that they will have to pay for the Part A because the Part A is free for people who have 40 work credits. But if you don't have your 40 work credits, then you have to pay for the Part B, Part A, and also the prescription plan. In the prescription plan, is the premiums, deductibles, and copays are different because they are also private companies contracted by Medicare, but the Medicare Part A premium is much high, is higher for people, once again, who did not pay into the system, who do not have 40 work credits. This year, in the year 2021, the Part A of Medicare premium is $471. $471 per person. And then you have to add the Part B, which is $148.50. So, but once again, if the person has lower income and resources, they can file for additional benefits with the state where they live in. Thank you so much. You had another question. Besides
Yes,
the
Diana.
question in the chat. Yes, tell me.
Yes, Diana, this is Osama again. So there were 2 questions in the YouTube chat. The first one is, how about Medicare for stay-home mothers? Is she eligible too?
Yeah. In regards to stay-home mothers, the answer is yes, because with, when we have a couples in which one of them is a stay-home spouse, they not only be eligible to the cash benefits, but they can also get Medicare once they reach their age. And in some cases, if that stay-home spouse is actually older, they can file for Medicare under the spouse's record that is younger. So absolutely, there will be Medicare benefits as well for that stay-home spouse. And the other question?
Okay, awesome. The second question is, what about self-employed people? What's the minimum age to get Social Security benefits for them?
Yes, for self-employed, same age, same age. And for self-employed, what I would like to say in regards to that is that you get those Social Security credits for as long as you declare the earnings that you have for self-employment, you pay the taxes, you get your credits. And also in terms of self-employed, for as long as you have net earnings. Net earnings. If you take a look at your self-employment schedule, take a look at the amount that is net earnings from self-employment. That's the amount that goes into your earnings record. So be in regards to self-employment, I know that if you are self-employed, you can request a lot of deductions from your income taxes. Just be cautious about that, because the more deductions you have, the less that you are contributing into the Social Security system. And therefore the earnings are less. In some cases, you might not have enough earnings to earn those credits. I encourage that all of you who are watching create an online account, My Social Security online account, because I told you at the beginning, we are not mailing your Social Security statement as we used to many years ago. We are only mailing the statement to workers that are 60 years and over. And you need to get that information about your future benefits to make the right decisions. And you need to have access to your Social Security statement. It is important that you review your earnings record to make sure that it's correct, so you can really see how your earnings are working to provide protection for you and for your family. And also to take a look at the benefits that you are eligible for and the amount of benefits. So please try to create an online account. Any other questions? No. Okay, we're gonna continue then, and let's talk a little bit about, I told you when people are eligible for Medicare and we have people that have lower income and resources, the state provides some assistance, but also Social Security provides extra help. Extra help allows the Social Security Administration to provide assistance with the prescription drug program, payment of premiums, deductibles, and copays for those beneficiaries that have lower income and resources. I encourage you that if you know somebody in your family, in your community that has lower income and resources, and they are already Medicare beneficiaries, share with them that they might be eligible for other benefits based on income and resources. If that is your family member, you can actually help that person complete an online application for extra help. And also, you can refer them to the social services agency in the county or the jurisdiction where they live for additional benefits that they can apply with the state. Please share the information. We have, especially during this time, many of our senior citizens and people with disabilities that have lower income and resources and don't even know about other benefits that they could qualify. So please share the information with others, okay? A little bit of summary on SSI benefits. We talked a little bit about SSI already, and we even had a question about children who might be eligible for SSI. Once again, SSI is the supplemental security income that will allow Social Security Administration to pay benefits to people who are 65 and older, or any age but blind or disabled, and they have limited income and resources. And there are special rules for children, okay, but they could qualify. When we have people that are not citizens, there are some non-citizens, they can also qualify for SSI. And if they have been here living in the country, in legal status before August 22nd, 1996, they could qualify. But there are other categories of people who could qualify if they are, for example, asylees or refugees, or if they are the child or the spouse of a person that has already 40 work credits. A little bit of a reminder in regards to a program that is very, very important for us as an agency, and that is the representative pay program. Because if you take a look at Social Security overall, we provide benefits to older Americans, and we also provide benefits to some people that are disabled. And in some cases, either older Americans or people with disabilities, including children, they cannot manage the benefits on their own. And that is why we have the representative pay program, which is for people who cannot manage their benefits. We will assign a representative that will assist them. And that is most important for vulnerable populations, especially, once again, children and people with disabilities. In general, when we're talking about applying for any of the benefits that we talk about, retirement, disability, Medicare, or even spouses benefits, we go back to the way that you can contact Social Security during the current health crisis, and it's either online or by calling our toll-free number. You can always file online for benefits. We have very easy, convenient, and most of all, secure applications. If you cannot complete your application online, you can give us a call at the toll-free number so we can schedule a telephone appointment for you. When you're ready to get benefits, either retirement or Medicare, contact us 3 months before so we can have your benefits ready at the time that you need them. And before I stop, so I can answer more of the questions that you have, I would like to invite you to visit us online, ssa.gov. We have in our website publications, calculators. You can create your online account, My Social Security. That's your online account that will allow you to get information about your future benefits or to manage your present benefits. And through your online account, you can get a replacement of your Medicare card if you need to, if you're a citizen, and that service is only available in some states, not all the states. So find out if it is available in your state. Also, you can get online a visit. You can visit us. We have blogs, we have publications. You can register to our newsletter. You can register to receive our blogs with very good information about all the benefits that we administer. We have YouTube videos. We have Facebook. You can actually send those questions through Facebook, and we will be more than happy to respond to you. Like in Facebook, it's usually used for friends. Like a good friend, we will answer all of those questions that you send us through Facebook. So there are many, many things that we are doing as an agency to provide you with the information that you need about your benefits. So get ready to retire, know more about your benefits. Visit us online, and I'm going to stay on the line now so I can answer more of the questions that you have. But once again, thank you once again for attending. Visit us online, create a My Social Security online account, and most of all, from all of us at Social Security, stay safe and well during this health crisis. And it looks like now that more and more people are getting vaccinated, we are getting ready to get back to normal. So Thank you so much. And thank you for inviting me once again.
I think we have one question left.
Yes.
If a person full of age retirement, full retirement age, after he can live outside the USA, he still can collect the
Sure.
SSI. Yeah.
Yes,
SSI.
absolutely, yes.
Mhm.
Social Security pays benefits outside the United States. There are only very few countries, and just from the top of my head, what I can remember, North Korea, we are unable to pay benefits in North Korea, and there are some other countries that there are some restrictions. But yes, we pay benefits outside the United States. My advice to you will be that if you can, possibly start collecting your benefits, file for your benefits while you are in the United States, and then just make a change of address to your country, to the country where you want to get your benefits. But if you are already outside the United States, then contact the nearest federal benefits unit. Federal benefits unit. In order for you to get the information of the federal benefits unit that service the country where you are, you can visit us online, and we will provide you with the information, including in some cases, an email address, so you can get in touch with the federal benefits unit if you are already outside the United States. Thank you. Any other questions?
Yeah, I have one question.
Dinah,
Yes.
Like two spouses. One spouse retired after full retirement age,
Mhm.
and then the other spouse is still working. And then when he or she turns 62 or 63, can that person apply to the for the spousal benefits instead
Sure.
of applying for your benefits?
Okay, of course. So in this case, we have one spouse that has already retired, and then another spouse working. Well, once the spouse that is working retires and files for benefits, we're going to take a look for both the spouses.
Mhm.
Which benefit will be higher for each one of them? So we can pay those benefits. Let's say that the spouse that was working has the higher earnings record. And once that spouse files, we determine that the one that was getting benefits already can get more on the spouse that just retired. We're gonna make the adjustment. Just know that, please, that if you're married, if you and your spouse have work, we will always take a look. We will always make a comparison on which record we can pay you the higher amount of benefits. Okay?
Okay, thank you very much.
You're welcome. Any other questions?
yes, Dinah, I know we've gone past our time. Just one last question on the YouTube chat, and I think you may have already hit this, but the question is, what options are available for U.S. citizens who do not have enough credit for Medicare? So those who don't
Okay.
have enough
Yeah.
credit.
One options for people who does not have 40 work credits in regards to Medicare. Once again, there is an option. You can file for as long as you are 65 or over. You have at least a permanent residency card, and you have been living continuously in the United States for 5 years. Those are the minimum requirements for you to file for Medicare. If you at least meet the minimum requirements, I encourage you to contact us as soon as possible. You can give us a call at the toll-free number 1-800-772-1213 and ask for an appointment. So we will schedule a telephone appointment for you to file for those benefits.
Great.
Thank you. Any other questions?
I have one question. What is the difference between Medicare and Medicaid?
Sure.
A lot of people are confused.
Absolutely.
That one is state run and one is a federal run. So how can they differentiate. Okay.
Correct. Medicare. Medicare is federal. And the way to kind of make it easier on you to know exactly what it is that take a look at your pay stuff. You pay Medicare taxes. So you become eligible to Medicare by paying those taxes. So that is federal. It has nothing to do with income and resources. That's Medicare. That's the National Health Insurance Program. And then we have Medicaid. Medicaid is a state-based program. It can give eligibility to people, children, women who are expecting, the elderly, people with disabilities, but it's a state-based program and it's based on income and resources. So that's the main difference between Medicare and Medicaid.
Good.
Thank you. Any other
Thank you.
questions? Oh, you're welcome.
Okay, Diana, on behalf of the Islamic Community Center of Laurel, we thank you very much for joining us today. You explained so many important topics in such a clear and precise and eloquent manner. So we think that the Social Security Administration is very lucky to have you as a public affairs specialist, and we are very fortunate to have you with us today. Once again, explaining everything in such an articulate manner. So we thank you. We have been planning this program for a very long time. Mrs. Farida Zaberi told the program committee about you, so we knew all about you many months ago. So we were just waiting for the right time to have this event, and we have it recorded on our YouTube page. Many of us got a lot of benefit today, but the rest of the community will definitely be getting benefit from this over the next few days. So once again, thank you very much.
Well, I really thank you actually for inviting me. It has been a pleasure to share with you 1 hour and a half and to answer your questions. And once again, thank you. And I'm really hoping that the next time I will actually meet you at the center. So thank you. And
Yeah, I would say that, we would, you will have a good snack. We will serve always good snack. So
that would be awesome.
next time when we have a live meeting, we will have some, snack and some, interaction. We see each other. So
I am
thank
looking
you very
forward
much.
to that
Thank you very much.
time. Take care.
Great. Thank you.
Stay
Very
well.
nice program. And thank you very much for the ICCL and for the Social Security Administration to really participate and, provide such a nice educational program for everyone. Thank you.
Thank you once again, everybody. Take care. Stay safe.
Mhm.